All right, management and prevention of sports injuries. First of all, how do we classify sports injuries? Well, we've got direct and indirect injuries. Direct injuries occur directly at the contact site. Indirect injuries occur away from the contact site. Hard and soft injuries. So hard injuries affect either the bones or the teeth. Soft injuries is everything else: muscles, ligaments, tendons, skin, etc. An overuse injury develops over time from either too much training, poor technique, or inadequate recovery. All injuries can be classified as either one of each of these or all three of them. So you may have a direct hard injury, you may have an indirect soft overuse injury, or you may have a direct soft injury. All right, how do we assess sports injuries? Well, we use toe taps method: talk, observe, touch, active movement, passive movement, and a skills test. We are not going to go through steps of toe taps if you fail a previous step, or if it's obviously a life-threatening injury or something that is obviously hard tissue. It's just 000 and we're not going to do toe taps at all. How do we manage our injuries? Well, we're going to use the police method for a soft tissue injury, which replaces the old Ricer method. We'll use PER for lacerations to stop the bleeding. Or if it's a hard tissue injury, we're going to immobilize it, apply ice if it doesn't cause too much pain or discomfort, and 000 or get them to hospital ASAP. Okay, rehabilitation of our sports injuries. 3-step process. We've got progressive mobilization, graduated exercise, and modified training. Progressive mobilization, we are going to do this as soon as possible, not like immediately post-injury, but as soon as you're able to actually get some movement and you're cleared by the doctor to start training again. So it's going to decrease scar tissue developing in the area. You should always heat prior to doing progressive mobilization or any sort of training, and you should apply cold straight afterwards to reduce any excess inflammation. Graduated exercise, we're going to move from bodyweight exercises or just slight movements to using bands, to then using strength training over time. Also, flexibility needs to be graduated too. So from small static stretches to larger static stretches to dynamic, etc. It's going to realign our new fibers and make sure we're laying good foundation. Finally, when we do return to training, we're going to be modifying our training sessions. We're going to start slow and build up, because the last thing athletes want is to get re-injured again before they're actually able to return to play. Finally, when do athletes know when they are ready to return to play? So firstly, we need to apply any policies and procedures that are sport specific, such as the 14 to 21 concussion delay in league. Must complete some sport-specific tests, such as a netballer demonstrating that she can perform or he can perform a single leg landing. Psychological readiness must be assessed as well. The athlete must be mentally confident, otherwise they're more likely to get re-injured. So you can't be thinking about or shielding an injury mentally, because you're probably going to injure a different part of your body. And ultimately, the responsibility for returning to play comes down to medical clearance from your GP or the medical team. Regardless of the pressures in your life, athletes should not return to play until they are cleared. And that was your too long didn't study version of sports injuries.